Happy Monday morning. Good morning. Good morning. I don't know when you will watch this. It may not be in the morning, but this is Monday morning when this is done, and I am live. This is Faye, and I sell Medicare plans. The thought came to me that Medicare is so confusing. Why don't you just spend a few minutes once a week trying to explain some of the parts of Medicare and how they all work together and how the doctors work with the plans and the plans are set up and all of those things. Share with everyone what I know about Medicare. So, you know already that I've been doing this for more than 20 years. I am also a card toting Medicare beneficiary. So I do know a little bit about how it works. I'm going to start this series with Original Medicare. Original Medicare. And that is the red, white, and blue card. It's the one that has your name. It has an MBI or Medicare Beneficiary Identification Number. And that number is no longer your Social Security number. There was once a time when that number was your Social Security number and it had a letter behind it which identified if you were the primary Medicare beneficiary holder or you were dependent from someone else. But now everyone has a unique Medicare identification number that's only your number. And it's sort of like a social security number. Your social security number is one that only you are assigned. So once you are eligible for Medicare, you get that Medicare number. And it includes letters and numbers. And there are dashes between the sets of letters and numbers so that you know that that's what the Medicare identification number looks like. If someone says, "What's your Medicare number?" it is not your Social Security number. So now the parts of Original Medicare are A and B. And so, as not to confuse the issue in this series, we're only going to take one thing at a time. But you, of course, can put your questions in the chat. When you see this, you can, of course, send me your questions at any time. I'll make sure that my number is posted here someplace so that you know how to reach me if you have a question. And I'm happy to answer the question here on Monday mornings for you. So grab a cup of coffee, sit down, and I'm going to tell you about Original Medicare today. So let's start with Part A, and that's A for Apple. Part A is hospitalization. Actually, let me back up and tell you where it all comes from. Medicare is housed under the Social Security Administration, which is housed under the Department of Health and Human Services. So it's a federal agency. So as you are working, or perhaps your spouse is working, if you're not working, anyone who is working and you're receiving wages, W-2 wages, you are paying Medicare taxes. And you see that in your check. Those taxes are deducted as you receive your paycheck. So if you work or your spouse works, because you could become a Medicare beneficiary through your spouse, if you work or the spouse is working and you work for 10 years or 40 quarters, and they do not have to be continuously. They don't have to be year after year after year after year. You may have worked a few years when you were young and in college, and then you went to college, you didn't work, and You got out of college, you graduated, you did post-grad work, whatever, and you weren't working. And then you got a job and you were working again. So it's any time during your lifespan that you have accumulated 40 quarters or 10 years of working and paying into the Medicare system. Now, when you reach age 65, so you got from the time you start working, which may be 18, 20, 21 years old, to age 65 to put in those 10 years of work. And it doesn't matter how much your earnings are or how much you're paying into the system because everybody's pay is different. It's just that you have to do it for 10 years or 40 quarters between your starting working age to age 65. And then at age 65, you become eligible for the Medicare Part A, which is hospitalization. On your card, it says Part A, hospital. You become eligible for that regardless of anything else. So just remember that. If you've done that, you meet the age, you meet the requirements that you paid into the system, then Part A is yours without any payment from you. You've earned that already. I'm going to say it again because I really do want you to understand how this all works. So Part A, hospital piece, you get that when you become age 65 through your working years, no matter when you start, 18, 19, 20, 30 to 65, as long as you work sometime in there and pay into the Medicare system for 10 years or 40 quarters, then Part A is premium free for you. You get that. So when does it become effective? It becomes effective on the first day of your birth month, unless your birthday is on the first. If your birthday is on the first, then it's the first of the previous month. Example, if your birth month is February and it's February 4th or February 20th, then your effective date would be February 1st. But if your birthday is February 1st, then your effective date is January 1st. So that's how the effective date works. Now, there is another way that you can actually get that Medicare piece. And that is if you have become disabled and you have not reached age 65, but you are totally disabled according to Social Security disability, and you are collecting Social Security disability payments for 2 years. So you could be age 55. You've already worked 10 years. You're paid into the Medicare system, and you are diagnosed with an illness that makes you totally disabled. You've applied to Social Security, and they say, yes, you're totally disabled, and start to pay you Social Security disability payments. And once you receive those payments for 24 months, then on the 25th month, the first of that month, you would be eligible for Medicare Part A. Now, that takes care of Part A. I just have enough time today to touch on Part B. Part B has a premium. The premium is set by Medicare. It's not set by me. It's not set by anyone that I know. It's not set by the insurance companies. It's set by Medicare. So every year, Medicare decides what that premium is going to be. Now, I've already told you that I have been doing this for a while. So I can remember when that Part B premium was $96. And then it was 104 for a while, 104, 106. Well, currently, this year, 2024, that Medicare Part B premium, standard premium, not including people who are high wage earners, but if you're just standard earner, then that premium for Part B is $174.70. So that's per month. And Social Security receives that payment so that you have on your red, white, and blue card when you receive it both parts A and part B. Now, you could refuse to pay the Part B premium because it's a choice, because you have to pay for it. There are instances where you may not pay for it and the state that you live in subsidizes it or pays for it. But for most people, that Part B premium is something that you would actually pay. As I told you at the beginning, Medicare is confusing. This morning, we've talked about Medicare Part A and Medicare Part B. Stay tuned and join me again next Monday morning, bright and early, or whenever you watch this video to learn more about Medicare and the intricacies of how Medicare works and how it works for you, because there will be something that I'm sure I could tell you that you did not know already. And you may have questions. So feel free to text me your questions, to call with your questions. I'm Faye, and I sell Medicare plans.